everyone. This is Jason Leonards. This is episode number 323 of Revolutionary You, proudly brought to you by Revolution Fitness and Therapy. This is episode 3 of 4 with Dr. Lisa Lewis. I hope that you've enjoyed the first two episodes that we've had so far together. I thought they were fantastic. I know that I'm totally biased, but you know, when we get to have conversations about mental health, it always helps to have a very qualified professional in the midst of those conversations. And somewhat timely, and something that Dr. Lisa and I were talking about offline before we hit record, this particular topic is on the notion or the theory behind using strength training for mental health medication. And what the listeners may not know, depending on who follows me on social media, is that in the wee hours of last night, or certainly while I was sleeping last night, the parent of a former client of mine sent me a message, and I have to paraphrase it because I don't have it right here in front of me, but said that you know, my son is decided to double major, and he's now taking his original major, which I believe was more business related, and he is going to also major in exercise science with a emphasis in nutrition, and this is all because of you. And he found that through, you know, learning how to exercise appropriately and through eating better, that he no longer has to be on his depression medication. And of course, you know, as a coach, it's I can't think of kinder words to hear, but there's some story to tell behind that, which is, you know, when it comes to this particular client, we didn't have a lot of conversations about his depression, and we didn't have a lot of conversations about the medication that he was on. So there was never any bias or leanings, not that there would have been, that, hey, if you just work out, you know, or just eat better, that you're going to get off your meds. You know, that might be the case with certain things, but certainly not with depression and things like that. But Lisa's going to be able to lean into this a lot more than I can. So on my Instagram, I got to kind of emote a little bit about that and just sort of look at a couple different sides of the argument, because for one person who finds an outlet and they find that perhaps medication is no longer needed, there are other people who absolutely they need to be on medication because it gives them their best life. So Lisa, I'm gonna turn it over to you on that note, because my God, just like our last two conversations in this series, we can go so many different directions, but I'm gonna let you take the wheel.
Thank you. There are many directions to take that vignette and that example. So I have about 5 different directions in my mind. But I think the most important place to start is where I think you ended, which is, for some people, you know, engaging in strength training will take the place of medication or prevent you from ever needing medication. And for other people, it'll be a great supplement or add-on to your medication. And I think this whole topic, what is underneath the surface of this story and this topic, is the stigma that comes along, not only with mental health problems, but specifically with medication for mental health problems. You know, if you had a red itchy rash all over your arm and you were like, if I just, you know, took a third shower, and if I just ate only green beans and kale, and if I just, you know, wore organic socks, maybe I could get the rash to go away. After a week or two, right, your wife would be like, get your ass to the doctor and get some cream for right, your rash, because that is red and itchy and it's uncomfortable and it's not nice. But for some reason, when it comes to mental health, you know, people think about it as something that doesn't really exist, or something that's there because of a character defect, or because you're not doing something hard enough or good enough. And nothing could be farther from the case. And medication is one tool of many that can really, really help with mental health problems. That being said, exercise is an extremely effective treatment for every single aspect of mental health that you can think of. And most of the ideas that I'm going to share next come from a book called Spark. And Spark was written by Dr. John Rady, who is a psychiatrist over here at Harvard Medical School. And his whole shtick, his pitch, is that exercise, the purpose of exercise is neuroplasticity. The brain is plastic, which means it can change in its structure and in its function, and that you can increase and alter your hormones, your neurotransmitter materials, and even the functionality of your brain by using exercise. So Dr. Rady says there are these like side effects of exercise, which include being leaner, being stronger, being sexier, having fat loss. He's like, that's all like extra stuff. The main function of moving your body and exercising is improved cognitive, emotional, behavioral, neurological functioning. And in that book, chapter 2 is stress and exercise. Chapter 3 is anxiety and exercise. Chapter 4 is depression and exercise. Chapter 5 is ADHD and exercise, and on and on. So any way you slice it, this is the take home from today's podcast. Any way you slice it, exercise equals good for your brain. Whether you have problems with your attention, problems with your self-esteem, problems with anxiety or depression, or eating or sleeping or sex drive or exercise is one type of treatment for that ailment. And we can talk about any of those in more specifics, but I think that's the most important takeaway. Is it a replacement for medication? No, I don't think so. I think there's no reason not to do it. And in fact, in the absence of exercise, there are negative outcomes for you physically and psychologically. So it's not something like extra to add. It is part of what you need in your life, of course, to be healthy. But adding it on, especially in an intentional way, if you are dealing with some kind of mental health problem, is most certainly an intervention, is a treatment.
Lisa, let me ask you this, and I know that I may be kind of stepping out of either of our wheelhouses because I don't have the pharmacological background, and I don't know to what degree you went through that with your studies. But if I could just sort of ask your professional opinion, when I did the post about the message that I got, one of the people that I tagged in the post, aside from yourself, because again it was very timely that it came up on the day of our recording, was I tagged Georgie Fear, who many of my listeners may listen or may know who she is, but for those that don't, she's a dietitian based out of Canada, and she's been on my show a few different times. She's always just been a wonderful guest. But our very first episode that we did was, I believe, episode 51, and in it we both spoke about our past histories with medication, and I framed it up from the viewpoint of I had been on medication for certain circumstances that were happening in my life. Finally got into the hands of a doctor who said, based on the things that I'm seeing, based on the things that we're testing you on and all this stuff, you don't have the diagnoses that these other doctors thought that you had. Therefore, I don't believe that medication is the right thing for you. And so little by little, we just had to wean me off of everything. And I'm using that as the key words because I definitely know people that certainly take it upon themselves to say, I no longer need the medication, and they're just like, I'm going to stop cold turkey. And it's like, folks, I'm not a medical professional. Please don't do this. Please talk to a professional about this. But it's so that was my story. Certainly it's summarized. And for Georgie, and certainly I would recommend anybody go back to listen to that episode to hear it certainly more eloquently put in her words. But she had been on medication, decided to get off of medication for whatever reason she had at that time, and decided, what, my life is actually better when I'm on medication. So the reason why I'm bringing this up is because I do want to get your take. To the best of your knowledge, when does the average person know, hey, you know what, I'm just kind of going through a tough time, and medication may not be appropriate to get me through this hump in my life, versus the person who might truly have a chemical imbalance, who probably needs to be on this for the for the better part of their lives, for just like in Georgie's case, this is how I live my fullest life.
Yeah, that's a really good and a really hard question, and the answer is it's a case-by-case basis. And there is a way that prescribers think about this. So you're right, I'm not a prescriber, I'm not a psychopharmacologist, but I have worked in parallel with psychopharmacologists for almost 20 years now, and it is an area of interest for me. So there is a psychiatrist I have worked with for years who has presented many places also, and one of the ways that he talks about what you just mentioned is an endogenous depression or anxiety versus exogenous. Endogenous means it's coming from inside of you. Exogenous means it's coming from outside of you. So exogenous depression, what would that mean, for example? That would mean you lost your job at work and you're going through you went through a divorce, your kid went off to college, financial stress, life basically. So there are all kinds of reasons, things that happen in the environment in life that may cause you over time to basically create a neurological state of depression. So if you're stressed out all the time and you're not sleeping well and you feel negative about your future and your opinion of yourself is low, that's, those are the features of clinical depression. So that would be exogenous, being caused from the outside. Endogenous is, over the years, I have spoke with clients who have expressed something like, there is no reason for me to feel this way. I have a nice family. School is good. I want to be happy, but there's like this wave of like dark, or just, I always am worried about the future, or they'll describe it as like being incongruent with what's on the outside. And 99% of the time, there's family history of some kind of mental health problem. So that, one way to think about that is endogenous. There's something that is going on that's either neurobiological or maybe there's a genetic predisposition. Endogenous versus exogenous. The question is, does that change, or should that affect how somebody thinks about medication? And again, I think it all depends, because if you are down and out and you are depressed because something happened in life and it's exogenous, is that depression keeping you from getting another job or dealing with your financial stress, or in other words, meeting the stress and dealing with it and moving on with your life? Or is it kicking your butt and keeping you down?
Sure.
So if somebody's saying, well, I lost my mom or I lost my spouse, of course I'm down, I don't need medication, that's explainable. I would say, okay, it's totally explainable, but you're not able to work, you're not socializing with your friends, you're not able to function. And so I don't care if it's exogenous or endogenous, you need intervention. You need treatment. Somebody who's got endogenous, those people tend to be like, I'm being lazy, or I'm being selfish, or I like to blame their character because they can't blame anything on the outside. And for those folks, they want to know if they have to be on medication for their whole life. And I'll say to them, I have not got the foggiest idea. What I do know is you are not functioning well right now. You are telling me what I feel on the inside doesn't match what's going on the outside, and that probably has something to do with what's going on in your brain. Let's get you in front of a psychopharmacologist, have a conversation about it, and what would you think about trying a medication? And then I typically have a long back and forth to see what kind of stigma comes up, what the hesitations are, spend some time on that. So I'm not really answering your question because there's really not a clear answer. And I think Georgie's explanation is really a good one, is you have to see for yourself what works, what helps you to live your best life. And what I love the most about her response is the stigma of being on a medication is out of the way.
Right.
It's just about how can I live my best life, which means working hard and having good relationships and feeling successful, all of these different pieces. So often what I do, Jason, when I'm talking to somebody about mental health medication is to make some kind of parallel or example that is not mental health medication, like I did with the itchy red rash.
Sure.
So I have said to clients before, over the course of my life, I have had a lot of trouble with acne, all kinds of problems. And I have tried every diet there is, every restriction there is, every face mask there is, you name it. Like I have standed on my head and chanted, basically in order to clear up my skin.
Right.
And you know what? There's a medication I take, and when I take it, my skin looks better. Could I like erase all dairy from every single thing and only eat organic and buy the $100 thing? Yes, I could keep doing all that, but I'm middle-aged and I've tried a lot of things, and the medication helps. It makes my life better.
Sure.
And so maybe there's an alternative workaround, but for $5 a month and for clear skin and to go and live my life and have an occasional piece of cheese, I'm taking the medication. Thank you very much.
Absolutely. Yeah. That makes perfect sense. Um, so let's talk about exercise. I know we started with it, and when you said the book Spark, I'm like, wait a second, I know that book, and I felt like I had read it. But then as you started to talk about it, I'm like, maybe I haven't read this book. So this is one that I'm actually that I've made notes on, so I can circle back to it. But
You will love it.
I'm certain of it. I know my path to exercise, and I know you and I have talked about it before, but just for people that might be new to the episode or whatnot. So I got into exercise right when I was in the middle of drug addiction, and it was just something where I just sort of thought, I need to do something better for my body. I didn't like the way that I looked. I've always been built like a 12-year-old, so it was just one of those things where it was like, you need to do something. You need to do something to like make yourself look better. And so lifting weights was the thing that I tried, and I was like, okay, I could get into this. And everything went in stages for me. So it was like, I'm addicted to drugs because that's the thing, that's the cope, and that's actually what I fell into after I got off all the medication, was just, well, let's just do all the hard street drugs. So the gym became one thing and one type of an outlet, and then it became, maybe I should start feeding my body better food, better quality food. Maybe I shouldn't be running to Taco Bell and McDonald's all the time. And then all of a sudden it's like, okay, maybe now it's time to get clean. And so it took several years to kind of get through this. And like a lot of things in life, and something I think that you and I had even spoken about on one of our previous episodes together, as you grow and you age as a person, you start to evolve from, the people and the friendships and the relationships that have been a part of your life. And so stands to reason that when I get clean, I'm probably not, hanging around with the same types of people that I was when I was using. And I'm only talking to a couple of the people that I used to party with and all that stuff. And one of them has sort of gone almost the direction that I went. He's clean, but he's a ultra marathoner. Like he does the long, hard, crazy mileage races, and that's his thing. That's his, and I say this loosely, that's his addiction. And for me, it was probably the workaholism with owning a business like this. So when we take just this concept of, okay, I'm moving, I'm doing the good thing for my body. Is there such a thing, and why, and what do we do about it, about taking it too far? About just sort of chasing things from one end of the spectrum to the other and not knowing really how to moderate these things in our lives. Like, what's the stance?
It's a good question. And I feel, as an addiction counselor and as a lover of exercise, I feel that the too far is very, 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 very far. Like the spectrum is big, because even your friend who does ultramarathon or whatever he does, there are so many checks and balances in the way, which means if he's overtraining, he's going to get an injury that's going to sideline him. He's going to end up in PT. He's going to end up at an ortho. He's going to end up having a conversation about, you need to sleep and you need to eat and you need to have more recovery.
Yeah.
So something is going to present itself. Some women deal with overtraining syndrome or red S, which is, it starts to interfere with their hormonal system because they're exercising too much relative to the energy that they're taking in.
Sure.
And there are red flags and signs and symptoms that pop up. So in those cases, yes, those people are overdoing it. And I would argue that the exercise is their drug of choice, and they are doing it for escape or to kill pain or as a way to cope. And these are the negative consequences. Red S in particular can be difficult to identify if a person's, if a woman in particular is presenting with having stress fracture. But again, most people who are listening are like, what the hell is red S? I've never even heard of it.
Sure.
It is affecting a small percentage of a population that is typically engaging in endurance sports. And it tends to affect younger women who are very, very active and who are not eating enough. So I think the areas of risk are far outweighed by the areas of benefit. And in fact, there are people like your workaholism, for example, has benefited you in many, 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 many ways.
Certainly.
Your friend getting really into and being kind of addictive or obsessive with his training has benefited his life in myriad ways. So sometimes the way I talk to addicts in particular is to say, you're diving into something and you're being intense about it. That is a superpower. And you can use that superpower to pursue goals that are in alignment with your values, because getting high and getting wasted every weekend is not in alignment with your goals and your values.
So let me sort of bring this back to base level. And I almost want to pose this, as the hypothetical patient of yours. If you see that I'm, in a bad way, whatever that way is, something that would probably qualify as someone who may or may not need medication for depression. And you ask me the question, Jason, are you exercising? Have you thought about exercising? Talk me through that. Let's just sort of bring it back to, just sort of like the base level of when that conversation starts between you and a client about just presenting the option of exercise. And, what does it look like for someone who's in that rut? They're at that, I'll say rock bottom, because it's the term that I associate with the most, but I know it doesn't mean the same thing to other people that it might to you or I. But that person's finally just kind of their head's against the wall. They're looking for help. They're looking for options. They're looking for outlets. How does that conversation begin as you're starting to introduce strength training or exercise to this patient?
Yeah. First of all, by the time somebody's sitting in front of me, they've had a problem for a while. So it might not be the rock bottom, but they're overdue to see me by the time they come to see me. So that gives me leverage because they want relief. Number two, by the time we get to the exercise question, we've been talking for 20 or 30 minutes. So I have an idea of lifestyle. I have an idea of strengths. I have an idea of the individual's motivation. So I have some pieces of information to work with. I don't come out of the blue and say, you should be exercising. So by the time I get around to asking about what's your social life like, what are your hobbies like, talk to me about exercise. I live in a major metropolitan area where most people are educated, so everybody basically knows they're supposed to be exercising. So if somebody is, they tell me what they're doing. If somebody's not, they're like, no, I'm kind of not. You can tell by either what they say or what they express non-verbally that they don't feel good about the fact they're not exercising. So if they are not, and if they are presenting, by the time we get to this point in the conversation, we've already had a back and forth about they're feeling down, they're not feeling good. So I will say something like, you know what, this is really a point of opportunity, because there is a way we can add intervention that's going to work like medicine for free if you want it to be, and that's exercise. Because you're saying to me, kind of don't feel good about the fact you're not exercising, and exercise works like medicine on depression. And so if they don't know about that, I will do a little bit of psycho-ed. If they say, what do you mean by that? I will say, one of the leading hypotheses about what causes depression is not having enough serotonin circulating in your brain. And so when you exercise, you increase the reuptake of serotonin. When you increase the reuptake of serotonin, that has a similar effect to something like Prozac or Zoloft, which is a serotonin reuptake inhibitor. Right. So you are creating a state in your brain, an environment in your brain that is similar to what happens when you take an antidepressant. That's number one. Number two, you also have a positive effect on the amount of dopamine in your brain, which works like reward, which acts like motivation. So it will help you to feel more motivated to do things like get yourself to work or get yourself to class or call back friends or do things in life where you feel like you're kind of flat and you're stuck. It increases the rate of your production of norepinephrine and other kinds of neurotransmitter materials, which are going to help you. And then I'll draw from what they told me to have a better sex drive, to have more appetite, to be able to fall asleep at night. I'll cherry pick. Those are all true things, but I will try to name things that they have described to me as presenting complaints. And you can always do it because particularly with depression, there is a really nice big fat body of research that is both short-term and longitudinal to show that exercise is medicine for depression. There's a longitudinal study that everybody out here would like. It was called SMILE, that's the acronym, and it followed thousands of people for years. And not only is exercise a treatment for depression, but it also prevents relapse of a depressive episode. So I will do some psycho ed around it, and then I will gauge again, you know, so how does this sitting with you? Like, I'm going on and on. I'm sure it sounds good, but how are you feeling about it? I'll try to assess where they're at with it. And if people sometimes when people are depressed, they just feel so incapable. They have such low belief in their own abilities. We'll talk about that. Like, what do you like doing? Well, I know I should be running, or I know, no. If you like to do the hula hoop, let's talk about starting with the hula hoop. Right. What kind of physical activity? So then I'll talk to them about, number one, you got to find something that you're going to enjoy and is not going to be like torture. Number two, how about sampling? If you're not sure, what are some different things you could Google and see if you could do online or find a class? And then if somebody has something they like, or maybe they're doing a little something, I talk to them about dosage. So frequency, intensity, duration. Those are things I care about when it comes to exercise and mental health. Frequency, I want 5 episodes a week. That's the CDC standard. And that means that you're going to have a therapeutic effect if you can get it in 5 days. I will take 3 for start, but let's shoot for 5. Intensity depends. If you are a person who likes intensity, that's awesome. You can do something like interval training, or people like HIIT classes or kickboxing classes, things like that. But it does not have to be very, very intense. People who have anxiety disorders can benefit from doing intense training, because there is some evidence that it works like an exposure to an anxious state. If you think about being really, really anxious, your heart rate's high, your adrenaline's pumping, you're outside of your comfort zone physiologically speaking. And so there is this idea that when you're exercising vigorously, you're creating that same state. And so when you practice being in that state, you build up a threshold or a tolerance to it. And so that can help people to deal with if they have panic attacks or have these really high peaks of anxiety. However, for the most part, the majority of research on exercise for mental health is on endurance, aerobic kinds of activity. Sure. Now, you can certainly lift weights and have an aerobic, weight training session. So I'm not saying you have to do jazzercise or anything, but what I'm saying is I want your heart rate elevated so that it feels like you're doing at least a moderate level of work. And then the duration is, I like 45 minutes. So you think about like how many milligrams is that pill you're taking? I want that to be 45 minutes. I will take 20, so we can see some therapeutic effect, some difference at 20. 40 is like, that's the gold standard. So if I tell people, try to get a 45-minute workout where your heart rate's up and you're breathing heavy and you've broken a sweat, that is going to ensure that you've gotten enough dosage. And a lot of classes, like if people like cycling class or they want to go to a group X class, those are typically 40 to 45 minutes. So they can sort of plan, around that.
So I want to come back to something that you also said too, and of course, how we are in the fitness industry. We're always kind of floating within lanes, and so there's so much of the stuff that we have to talk about with clients that really sort of gets into your wheelhouse, and yes. Hopefully it's like anything else. Even if you're coaching nutrition, you hope that you're coaching the most accurate information. But yes. Something that I've certainly spoken to my clients about is something that I've had to do for myself, depending on how much insanity was happening in my life at a given point in time. Most recently, I would say that would have been probably right after our little guy Sebastian was born. But just the notion of a minimal effective dose, and I know you gave a time, 20 to 40 minutes, but I'll be more specific with this. Certainly on the heels of the pandemic, where people were at home, they didn't have access to gyms the way they were acclimated to. Perhaps they didn't have all the equipment that they were normally accustomed to. They've got bands, they've got body weight, maybe they have a couple of dumbbells. And I remember having multiple conversations with my clients going, I just need you to do 1 set of 10 squats, because motivation was so low and anxiety was so high. And so I do actually want to get your take on this, because I mean, we've all read, well, I shouldn't say we've all, but so many of us have read books like Atomic Habits and Tiny Habits. And so whether it be James Clear's work or BJ Fogg's work or whatever the case is, what is why is something like just get one set of squats in, why is something so small, why does it have such a good impact?
Because we gain self-esteem by engaging in esteemable acts. So self-esteem is one of those very common presentations, things people will say to me when I ask, what is your goal? What do you want to achieve in counseling? And increased self-esteem is really not a goal. It's an aspiration. It's an intention. And so I'll say, yes, that's good that you want that. The way that we're going to accomplish that is by you setting a goal to engage in behaviors that you hold in esteem. So the thing about strength training, I know I'm talking about exercise, and this episode is about strength training and mental health. The thing about strength training that I think makes it the best type of medication for depression and other mental health problems is because of its significant, undeniable impact on self-esteem, because it's black and white and it's numbers. So 10 squats, 2 pull-ups, deadlifting 200 pounds, like those are numbers and nobody can take that away from you. It's not qualitative. It's not doing a good job or being good enough. It's, I am going to accomplish these tasks that I personally value as being hard, as being something I don't want to do, as being a chore or being a task or being uncomfortable or being something that somebody does who's strong and who's resilient. So I love using strength training and recommending strength training for so many reasons, but namely, and I think I've told you before, Arnold Schwarzenegger talks about it in his autobiography, that when you lift a weight, you feel yourself do it, you watch yourself do it, you can see how much weight it is right there on the plate or the barbell or the dumbbell or whatever it is. Nobody can take that away from you. You accomplish that. And then you also can observe yourself lift more or lift longer or complete more reps or whatever. You can see yourself do more in just this very concrete, basic way. And I think that has an immediate effect of increasing somebody's self-esteem. I just did something I didn't feel like doing that really wasn't that pleasant, right? And I did it. So they get that boost of, I just have demonstrated to myself that I can engage in these tasks that I hold in esteem. And then they get all the neurological benefits of the physical activity that they just engaged in. So the physiological changes that happen in the body and the neurological changes that happen in the brain. So then they get this reinforcement kind of reward. Maybe their dopamine's up a little bit. Maybe they're a little bit hungrier after the session. Maybe they sleep a little bit better, you know? So they get that kind of reward after the initial, look, I did something I didn't want to do that I thought was too hard and I wasn't good enough to do it, and I did it. So it's good for their psychology, it's good for their biology.
You know, Lisa, on this note, and maybe this is, you know, where we'll sort of take this towards the, you know, the end of the episode, but as you're talking about this, and certainly I love the data because, you know, the way that we do our programming here, I have all of our clients have individualized programs. So we have a binder that's out in the front of the studio, and so, you know, when Lisa or Tony come in for their workout, I've already, you know, done their plans, and so we're just filling in the numbers and just making sure that, you know, everyone is in their respective place to do your to do your lifts and all that stuff. Talk to me about, you know, and I'm probably not going to get the verbiage right, but hopefully my memory's not going to fail me. You know, when we think about, certainly about the client that has goals, you know, and I'll use weight loss because weight loss is easy. Okay, I really want to lose 20 pounds. And I know we can get into all of the why and all that stuff and find those burning motivations and all that kind of thing. But, you know, you or we as coaches tend to try to pivot people. You know, it's not that your goal is wrong. It's not that your goal is bad. It's not that your goal isn't, you know, that you don't have a, you know, good sense of what you want, but trying to almost pivot these clients into something that is more process driven and really kind of being sort of lost in, but pay attention to what you're doing now and pay attention to how far you've come and all these other things. So talk to me a little bit about, you know, when we sort of look at this broad view. So we've talked about the importance of exercise, and we've talked about how it could potentially be benefiting our mental health, whether we need medication or we don't. It just, there's no downside, you know, to using this as a supplement in our lives. Where do we consider the importance of understanding this big overarching process towards a goal?
The example you gave of losing 20 pounds, this is an outcome. People always present with an outcome goal, something they want to get out of the behavior. And that gives them something to aim at. That gives them a big picture. That gives them something to fantasize over, to think about. And all that stuff is good, but it's not enough. So you need the processes or the tasks that you were referring to. And actually, the processes and the tasks are the things that are more rewarding to focus on and to think about and to collect data on as you go, because those things have to do with what you have control over and what you can practice doing. So you said, my goal is to lose 20 pounds. That's a fine goal, but there are lots of people who are probably going to hit 10 or 12 or 15 or 18 pounds, and then they're going to plateau for whatever reason. And probably there's plenty of cases you and I can think of where it doesn't make a bit of difference if they get from 18 to 20, or maybe it's better for their body to just have lost 16 as opposed to 20. So I think in the beginning, when you hear somebody in their goal, you get on board with that, you get pumped about that, you ask about that, you find out about how they see that, or how, to really understand that, and you leave the goal, in Dan John's words. But then in those programs or however you're working their workouts, you have these daily opportunities to get them engaged in the process by, number one, setting up, okay, your goal is 20 pounds. So what I'm going to have you do is when you come in to work out, we're going to work on your hip hinge. We're going to work on your deadlift. We're going to work on your blah, blah, blah. And then give some rationale, because that's going to allow you to get stronger. That's going to allow you to lift more weights. That's going to allow you to have a harder workout, which is going to help you to get into a caloric deficit, add more lean mass, blah, 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 blah. Okay, so you can do all that. And so as the person is engaging day by day, if you are setting up their workouts, connecting them to the outcome goal, and then you are teaching processes about how to hip hinge, or how to have a good deadlift, or how to do a body weight chin up, or how to stay moving in your workout so that you have, 45 minutes where your heart rate's up and you're not resting for 10 minutes in between sets. All of those little educational pieces give them something to be fully engaged with in the present moment. When you are fully engaged in the present moment, this is one of the definitions of kind of happiness, as Mihaly Csikszentmihalyi, who's the author of Flow, he writes about. He says people aren't really the happiest when they're like sitting around doing nothing. They're the happiest when they're like totally immersed in something.
Sure.
Really engaged. So if we can get people engaged in their exercise and fully present and thinking about the process of it, thinking about executing skills and tasks, we create this positive psychological state that they want to recreate, or that is rewarding. And those are in the service of their goals, so they can connect. It might not feel fun and rewarding, to be doing, I don't know what, pull throughs or some other, my foam rolling or
right,
whatever it is. But if they can identify, even though I don't love this in the moment, I'm doing it in the service of this overarching goal, it gives them a touchstone so they can go back and forth. And it gives you a touchstone also, because if they're 6 months in and they're like, I'm pissed off, I've only lost 12 pounds, I said I want to lose 20, you're having me fool around with all these pull-ups, how are pull-ups going to help me to lose weight? I'm really glad you asked that. I'm not surprised you're frustrated. Let's talk about it. And that gives you an opportunity to talk about progressive overload and how long it takes the body to adapt and how much stronger they have probably become if you're even having this conversation. So I don't know if I answered this question clearly, but I guess my take-home point is you need those tasks and processes, and what you also need to do is connect those back to the overarching goal.
Sure. And
continue to keep the goal, because the client cares about that. And if you are educated, anybody who's listening to this as a coach knows how to talk about physical adaptation, knows how to talk about the time it takes and the stops and stalls there can be in fat loss, and then how to connect what they're putting in the programming with long-term sustainable smart fat loss.
Sure. No, it makes sense. And again, you know, some of these things I was asking you, I wanted to ask specifically because, again, as coaches, we hear the information, and I think even as clients, you know, because a lot of my clients like to read about health and like to read about fitness or nutrition. And so, you know, depending on what they're getting the information from, they see the stuff, they hear it. But, you know, there's a difference between hearing it from, say, a journalist versus a psychologist, you know, someone who's actually in the trenches, who, you know, knows it on at an academic level and all that stuff, and really has to work with people in and out as opposed to just reporting about it. So, but so is there anything regarding this, regarding strength training, regarding how we utilize it for mental health that I didn't ask you that you want to leave listeners with?
Gosh, there probably is. But so I guess how I would wrap it all up with a bow is to say that strength training improves your mental health in several different ways. Number one, the self-esteem, the way that you show yourself that you can be big and strong, is not to be underestimated. You know, the second are these neurological changes, your brain's plasticity and physiological changes that occur when you exercise. And the third part of it is habit, the power of a healthy habit. And when you have those habits in your life, the people, places, and things in your life have to be congruent with that. So to go back to your point about when you're using substances, or when you're really depressed, or your life is consumed with anxiety, those days and the people you're with and things you do look very different than if you're exercising and eating right every single day. So whether you think about it from a self-esteem point of view, or a biological, neurological point of view, or a behavioral habit point of view, any way you look at it, strength training can serve you in improving your mental health.
I love it. We're going to leave it right there. Lisa, we have one more episode in the series. Looking forward to having the conversation, not looking forward to ending the series, but I'm so grateful for the time that you spent with me so far. I look forward to that conversation as well, but thank you so much for taking the time. I do appreciate it.
Thank you. Talk to you soon.
Yeah. For those of you listening, hope you have an opportunity to download, subscribe, share with your friends. If you have an extra moment, please leave us an iTunes review. We will catch you next time.